and this might give us a great opportunity to keep things intimate as well. So Arash is from Forge Health. He's a cardiovascular disease fellow at Emory. And I came across Forge Health through some conversations with Doximity, so I was really happy to hear that you guys are here in Atlanta. And I'm looking forward to having you talk about what you guys are up to. And because we've got a smaller group, we can probably keep it intimate. And yeah, it's football. So I'm excited to have you, Arash. So Lauren, American director, I used to work with Nate Gross.
Oh, really? Okay. Yeah, Nate was here last year for our first hackathon.
Okay.
He came and spoke. He judged too. Yeah. Right?
It's all long time, so.
Well, yeah, I mean, we have a smaller group, but it's really good to be here. I'll talk a little bit about sort of what Forge is doing, and talk more about sort of resources, funding, and clinical access, which is in bold, which will kind of be the focal point of the talk for digital health startups. So this is a little bit about me and some of the groups that I'm affiliated with that I have both professional and financial ties to. So I'm one of the co-founders at Forge. We'll talk a little bit about what Forge is doing. I'm a cardiology fellow at Emory, and I also work part-time at the Atlanta VA in the ED, where I'm also a research fellow for the time being. So I was gonna do like a brief sort of like histogram and see kind of who's in the room. And so we have, I think there's 5 of us here, so hopefully we have one of each. I was gonna see any fellow physicians or clinicians in the room. Remember, you were at our hackathon this past year. I know you're in healthcare as well, which is awesome. Any engineers, Jay, or I don't think we've met. I'm Arash.
Here.
Hey, how are you?
Yeah. Background.
Anyone that's actually started a company before? Awesome. And healthcare? No? Yeah? And I don't think there's any investors here that I recognize, but I was just going to start briefly talking about sort of funding in digital health. And so obviously, there's been a lot of interest with venture capital in digital health, and this is a slide from our friends at Rock Health. And so you can see that, back in 2011, when they were just shy of about $1 billion in funding a year, and Rock Health sort of defines their database includes deals over 2 million. But you can see from 2011 to 2013, you saw a huge uptick in venture capital flowing into digital health. So they topped out just shy of 2 billion in 2013. In 2014, that number surpassed 4 billion, and so far in 2015, they're right around 3.3 billion in funding, and they're on schedule to sort of pass 5 billion by the end of the year. And you've seen a sort of similar amount of interest on the exit side of things from 6 back in 2010, and this includes both M&As and IPOs, to about 30 back in 2014. So obviously there's a lot of interest in digital health. We've seen over 10 billion in venture capital flowing into the space since 2010. There's been a total of about 81 exits up until this point this year, both M&A and IPO. 3 of those companies actually went public at a valuation of over $1 billion. So that includes Castlight, Fitbit, and Viva. And so usually when you see this kind of growth in any industry, people start usually sounding the alarm about, sort of, is there a bubble? And do we have, companies that are overvalued? And that's kind of been the case here. We've seen some questions about the future of digital health and health IT, given just the amount of financial interest in the space. I think there's actually, in small parts, a good amount of reason for that. So you see a lot of projects that are similar in scope in digital health. So I kind of lost count of the number of companies working in telehealth and virtual medicine. You see a lot of companies with these kind of vague business models that also affect their revenue cycle. And so you see this sort of dichotomy in digital health and health IT between sort of who your customer is and really who your user is. So for my fellow clinicians in the room, a good example here is sort of like EMR. I would be sort of like one of the most common end users of EMR, but I'm not the one that pays for it. The hospital buys it on my behalf. And so what the hospital is looking for, in terms of a return on their investment, is different than what I'm looking for when I use the EMR. So you see there's a bit of a, there can sort of be, 2 different ends of that string being tugged and going in different directions. And I think this is where a lot of digital health companies what I was going to focus on are two, which I think are really poignant. So validation is really important. And an issue that a lot of companies are having now is actually proving that their concept works, that it has a clear clinical or economic benefit, showing that it's clinically relevant. A lot of companies now are focusing on generating new data, whether it's through sensors or kiosks, but you have to show that data is actually actionable, and that the person you're giving it to can use that data to make a meaningful difference in the healthcare system. And this becomes really important for later stage funding, for stage B investors and beyond, who are looking not just for proof of concept, but they want to fund scale and growth. So they want to see that your idea actually has some validation and that it has some traction. Another issue that's becoming more relevant now is the fact that someone's got to pay for these technologies. So reimbursement's an issue, and to do that, you have to demonstrate that your product has value. I mean, when they make these kind of acquisitions, these are not devices, these are not life sciences or drugs that specifically treat or diagnose disease. This is software. So they're looking for things that either increase revenue or reduce costs. And so I think those are things that we have to take into account. And obviously, might be remiss if I don't mention focus on HIPAA and FDA that are things that any company working in healthcare has to at least take into account. And so I think what people are doing now, they're asking sort of where's the science behind a lot of this? And we've seen a couple of cases this past year with the FTC, who settled with 3 companies over claims that they were making for their products. One of which was a company that claimed that they could improve vision, and 2 were for companies working in detection of melanoma in early cases. So I think, although I don't think this is sort of emblematic of the sector at large, obviously, groups like the FTC are taking notice. So the idea of validation is becoming, more and more important. So, the U.S. healthcare system is obviously, what I call a very target-rich environment. There's a lot of things that need improvement. This is just 4 very basic facts, but I think these are, probably some of the 4 most important. So number 1, healthcare is very expensive. The U.S. spends more on health. And that's a huge issue because, as the clinicians, we are sort of limited by what patients will do depending on what we tell them to do. So, I can't, force a patient to take a medication I'm prescribed, so that leads to worsening outcomes over time. And what I think is probably the most important issue facing healthcare is the issue of medical errors. And so there was a publication in the Journal of Patient Safety back in 2013, so that estimated was up to almost 500,000 deaths a year for medical errors. It actually makes medical errors, one of the leading causes of death in the country. So I think, these are pain points that, healthcare, or that technology can really work wonders for when it comes to healthcare. And if there's questions or comments, this small group feel free to chime in and interrupt me. So what I actually want to do now is do a really quick sort of case study in digital health and talk about a company that I think heard about them? Yeah. So Emanation Health is a great company. And what they do is their core product is something called Prevent. And it's a 16-week interactive program for patients who are at risk for developing type 2 diabetes. So, they began with the science, and we'll kind of go over that briefly. Built a product that, really focuses on the patients. It engages patients and it rewards them for good from good activity. And one thing they do that kind of lets them stand apart from other companies, they really focus on the outcomes, and they hold themselves accountable, not just publicly, but also to their customers on the outcomes that their program achieves. So the science that they base their intervention on is actually a landmark study from the NIH called the Diabetes Prevention Program. And I don't want to make this a talk about evidence-based medicine, but the basic concept behind this study and the outcomes was that they took patients at risk for diabetes, it's a multi-site study across the country, and then enrolled them in, they sort of put them in two groups, and one group was actually randomized to get just lifestyle changes. So they were enrolled in an intensive program of exercise, of dietary changes, versus the second group, which was put on a very common drug for diabetes called metformin. And they compared these two groups, and what they found was although that both groups had a decrease in risk of developing diabetes, to no one's surprise, the group that was randomized to lifestyle changes had a much marked reduction in risk. And the study was actually so compelling, they actually stopped the study a year early because they thought it was ethically, not appropriate to keep, randomizing these two groups of patients. So a model kind of began with this science, which is the first step. They kind of started with a good background rooted in science, but then they also, which is important as well, they applied it to the right population. So they didn't take the study that was on middle-aged Americans at risk for diabetes and then try and develop something that was geared toward childhood obesity or childhood diabetes. So they sort of stayed in their lane and really kind of started with a very basic concept rooted in science. They built a great product, I think, and I haven't seen it firsthand, but it's basically an online portal for patients, and this is kind of small, but it sort of takes them through 4 phases and helps them sort of engage in making healthier lifestyle choices. They get a scale that's wired to their account, so they can track their weight. They get a blood pressure cuff. It's just really easy to use, and it's really engaging. And they really focus on the outcomes. So to date, they've published 4 articles on their results. And these aren't necessarily high-impact medical journals, but they at least took the step of holding themselves accountable externally. And not only were they accountable publicly in the realm of the medical literature, but they also hold themselves accountable to their customers. So instead of doing more of a fee-for-service type of model, they do a fee-for-outcome. So they only get paid once. And the way their model is designed is that their customer is actually the health system and the insurance company, so they don't go direct to consumer. So the only time that their customers pay them is when one of their employees or one of their enrollees actually shows an improved outcome. And they have a good track record to show for this. So they have some major customers. One of them is Humana, another one is Kaiser. And if anyone follows the news, they just raised nearly a $50 million funding round, a Series C, a very impressive late-stage round, led by a couple of major VC firms in the West Coast, including among them Norwest Ventures and Andreessen Horowitz. So I think and this is and in my opinion, this is all sort of based on the very simple method that they adopted by starting with the science, building a great product, but also showing that that their intervention is based in science and it has real outcomes. And I think investors are looking to see that kind of traction. I think a lot of and so are your customers as well. Yeah.
You said that one of the reimbursement is one of the problems that startups face. So how does the reimbursement? They have to sign up a healthcare plan, and that somebody has to show you got that a year later before you get paid.
Yeah. So
it's a risky model.
It's a risky model for them because what they're saying is, we're willing to defer our revenue until we show that your employees or your enrollees have a difference in outcome. But despite that, so I have no formal ties with them. I don't know what their numbers look like. But despite that, they've been able to at least, and this is partially why I think they're raising bigger and bigger funding rounds later stage. But investors like this, and I think they at least, when it comes to getting someone to pay for your service, is what I'm getting at. They've actually incentivized their customers well to really buy into what they're selling. And I think that's what I'm getting at, is that, yeah.
So how, they can do this also things calculating.
Can they?
You have to input it yourself. It seems like it's important. I'm just wondering why you didn't have to right.
So again, I can't speak for Amada Health, But I think where they differentiate themselves is focusing on one specific disease and proving that their intervention works versus Fitbit and Jawbone, which are more focused on the broad wellness space, right? So there's no evidence that me slapping on a Fitbit on my wrist does anything for my health, right? You assume it does, but no one's actually shown that it works, right? And I think that's sort of what we're seeing is that there's been a lot of interest thus far, but to really go the distance, I think to really get people, to really get healthcare payers to buy your technology. If you want to sell Fitbit to a hospital, you have to show them a return on their investment. And so just, and more than just, give it to your employees and make them happy and feel great that you gave them a Fitbit for working for you. So I think that's kind of where we're going to see that bridge kind of being, seeing that gap being bridged.
I think their business model is a bit of skin in the game too. They're looking to do that. Whereas
I agree.
Yeah,
I agree. So I was going to pivot a little bit and talk a bit more about Forge. And so, we focused at the intersection of health and technology. And one thing that we're doing that we just launched this past week to sort of, address this issue of validation and feasibility is something called the Founders Forum. And what this is designed to do is actually designed to get, that startup tech directly into the clinic and the healthcare system to launch pilots. To show that there's feasibility and that to let companies show early stage traction with early stage pilots. We're building a very big network of mentors, clinicians and experts that I'll show you in a minute. We're offering a little bit of seed funding, up to $50,000 in a combination of grants, equity, as well as dedicated pilot funding, and putting companies through a crash course on all things healthcare, HIPAA, regulatory, reimbursement, and IP. So we think clinical access is very important. And so we're building pathways directly into the healthcare system. So these are our two sort of launch partners, our two launch clinical partners, Emory School of Medicine, and we just sort of finalized terms this past week with the VA Center for Innovation that kind of opens up the Atlanta VA and even beyond for our startups. We're building pathways for these companies into these healthcare systems to do two things really. So one, like I said, is to launch these pilots, and that focuses on what we sort of differentiate between front and back office pilots. So front office really in our minds, anything that focuses directly on care delivery versus back office, which is anything at the enterprise level, including big data, analytics, and beyond. And what we also, and so what these partnerships also do for us is that they give our startups access to healthcare experts. So faculty who can be PIs for pilots, executive champions, and also experts on healthcare delivery. Just a snapshot of some of our mentors who've come on board. This is a mix of entrepreneurs, investors, clinicians. We're adding experts in HIPAA, FDA, and reimbursement. And this is by no means an exhaustive list, just kind of like a starting point of where we're going from. This is one actual company that we're working with that's taken that similar approach to Amada Health. It's a company called Moving Analytics, and they work in the cardiac rehab space. And what they do is they actually provide in-home cardiac rehab to patients who are eligible. And cardiac rehab is something that's rooted in about 20 years of evidence, and it's shown to be a really effective treatment for patients that have certain cardiac conditions, heart failure, have had a recent heart attack, have long-standing chest pain. And what they've done is take that body of work, and then what they've actually found is recent evidence that shows that providing in-home rehab versus traditional rehab, and the difference there is that as it is now, if you're a patient that's going to get referred for rehab from your hospital, it's usually a third-party site. Most hospitals don't actually own their own rehab centers anymore, that you have to drive to, and it's expensive. Co-pays are per visit, and for a program that goes for a couple of months, $50 a visit times 30, well, that's expensive for even, for any patient. And so what they've done is they sort of digitized this model, and they're providing in-home rehab through a smartphone. And the data itself has actually been proven to show that they can engage 5 times more patients, and most of those patients that they enroll will at least 90% of them will finish the entire program, and it's a fully reimbursable service. This is a kind of a snapshot of what their intervention looked like. It's called Reuven, and again, this is a sort of smartphone that patients get access to the platform, and it shows them, what their workouts are for the day. They can track their vital signs. This sort of segues directly into some third-party sensors as well. And on the sort of provider side, it lets hospitals and rehab coordinators sort of keep track of a whole panel of patients. And kind of give them new exercises on a daily basis, track their progress, see their weight. Yeah.
Sorry, finish
That's it.
You said their patients finish about 90% of their.
The original study that this is based upon showed that 90% of patients they enroll into the cardiac rehab program in home finish the program.
How does that compare to?
I don't know the exact numbers, but it's a lot higher. I think I'd have to guess to say that if it's half, that'd be kind of like the status quo. My best guess. And the biggest issue when it comes to rehab isn't so much who finishes, it's the access to care. It's really hard to get these patients enrolled in these programs because, like I said, hospitals don't have it in-house, and it's expensive. So the mere fact that you're making it easy for patients to enroll in the first place and letting them do it in their house where it's convenient, I think is a huge sort of step in the right direction. Jay?
Is there a video device where you monitor them, or the patient self-reports?
Yeah, so there's no real-time monitoring yet. So it's all patient self-reported. So they have to type in their daily weight. They have to type in their blood pressure. And I think that's sort of on their like product roadmap, but not yet. And so this is a company that we're working to get into the VA to launch a pilot there where, for us at the VA, this is a huge issue. We cannot enroll our patients in the cardiac rehab. And this is sort of one intervention that we think will actually make a meaningful difference. So to summarize, I think, these are the kind of three basic steps that I think, most startups need to kind of at least think about. And that is to start with the science, really focus on the patients and build a tool that, really helps patients engage with your products. And then really, sort of stay accountable to the outcomes, both publicly and I think also to your customers. So I was going to finish a little bit talking about Forge and some of the things that we've done beyond the Founders Forum. And so, one of those things is our annual healthcare hackathon. We've done 2 now. The first one was in August last year here at Georgia Tech, and the last one was this past April that I think you were at, and you were on the winning team, I think. So congratulations. The second event was actually at the VA. It was a really cool event. We partnered with the Center for Innovation, and we kind of took over the Atlanta VA. They actually, the first thing they told us was that, there will be no, quote, hacking on a federal property. So we had to rename the event the Health Innovation Challenge instead of the Healthcare Hackathon. But it went well. I have a couple of pictures, and so we kind of took over the cafeteria. We had a bunch of 3D printers on site. We had some mentors there that were giving our team some feedback on site. And then we also do a lot of public events. We do salons. We do some meetups. This is our meetup from this past Tuesday that I think a few of you guys may have been at. So we kind of took over General Assembly for the night, and they were really nice to kind of have us there. And these are really more just like cocktail hours to get people together versus our salons, which are typically more sort of panel discussions focused on a specific theme. So, this kind of focuses on the goal of connectivity, which is kind of the foundation that Forge is kind of founded on. And so I'll end with a quote, and that is to, cure sometimes, treat often, and comfort always. Does anyone know whose quote this is? We're in the Academy of Medicine, that's a hint. Hippocrates. And I'll end there, and if there's any more questions, otherwise, that's my contact info. And so thank you all for letting me rant for the 20 minutes. So, thanks. Any questions, comments?
Yeah, I was wondering, there are population management companies like Calculate that have been in this space for decades. Do they have like in-house digital programs?
I wouldn't know.
Okay.
Yeah,
They're all exploring this, because they do see potential for using a way to communicate or connect with patients on more regular basis.
So I'm just wondering, in terms of an entrepreneur competing with an in-house program that's $3 million.
yeah.
Any thoughts on that?
It's not to say that there aren't major barriers to entry. I think that obviously, with the onset of capitation and I think population health obviously is going to be a big thing. Do I think there's room for new sort of players in the market? Absolutely. I think a lot of hospitals are looking to work with smaller companies, at least when it comes to cost, especially ones that can adopt a model that shows that their intervention actually that it works and it has good outcomes associated with it. If everyone took that mindset, then there would sort of be no there would be no Facebook, there would be know a lot of companies that already had bigger players in the market. So it's always about finding a way of differentiating yourself. And I think one way that a lot of digital health startups can do that is really by focusing on the validation, showing that their technology is not just another sort of play on the market, but really by going out and doing the work, they can show that this technology actually makes a difference. So I think there's room. I can't speak to specific sort of companies and what they're doing and how they're doing it, but the question is, do I think there's room for new players? Absolutely.
Well, I guess the flip side of that question is, what's your plan? Go public or sell out? What's the end game?
And that's a great question. I think we've seen a lot of IPOs in the past couple of years. And there have been more IPOs than actual M&As. So a lot of them are trying to go public. Whether that's feasible for a lot of smaller companies, I'm not sure. I think a lot of them may end up being acquired by some of the bigger firms. And I think that's an active strategy that a lot of companies kind of shoot for. It's because it's hard to compete. It's expensive. And so if you really want to get your product to market, you think about sort of what's the best way of doing that. And is that me, raising more money and going public, or is it, me being acquired and distributing through a bigger firm? The market obviously shows that, later stage investors who typically come on board before a planned IPO, there's definitely interest there from the investor side of things. So I think you'll see a lot more of these companies going public. So, I would venture to say that Amada Health would raise a Series C round if an IPO wasn't on their agenda. So I think we're going to see a lot of activity there, but we're seeing more and more sort of late stage interest in some of these companies, which is I think really sort of which I think kind of says a lot about good companies like that.
I have a question. I'm new to healthcare, so
Welcome.
I got the term from, but you say start with the science, but there's this whole trend now that one side doesn't fit all. People have genetically disposed to react to different things. There's no ratio.
Yeah.
ADHD, medicine, you just have to get to them and check. So when you start with the science, it seems like it's top down. It seems like we should be put, you mentioned personalized medicine,
Yeah.
what's right for patients. So where do you see that fitting?
So I think the idea that personalized medicine, so that's a very sexy public concept, right? The idea that it's bottom up, I disagree with.
Again, I'm using the
Sure, and so I think I think precision medicine, quote unquote, or sort of trying to find the right treatment for the right patient at the right time, I think is inherently a scientific question. How do you know that it's the right treatment for the right patient for the right time? You have to sort of base these in some kind of science. I don't think anyone in health, and so one of the biggest critiques of so-called evidence-based medicine is that there isn't enough sort of hard evidence for everything, right? Maybe 5% I've heard of all of the things that we do in healthcare is actually rooted in true hard science. A lot of it's based upon assumptions and consensus, and there's nothing wrong with that. As long as you're sort of forthcoming with what your sort of assumptions are, but you have to at least start with some sort of basic science. And so, yeah, I think is precision medicine important? Absolutely. Do I think that sort of butts head with the sort of approach of starting with science? Not necessarily. I think it's inherently a scientifically based question. And I'm not a geneticist, and that's not my area of expertise, but I think it is by far a scientific question.
Yeah, so here's the question: about somebody's student care or something who so how could you say, how do you make claims for things
And I think that's the question. At least I think the FCC in this example is at least taking note that when you're marketing some of these technologies and you're saying my company can do this publicly, then you better be able to show the science behind it. And again, I don't think that is emblematic of the entire digital health sort of sector. But we've seen 3 cases this past year, which is more than in the past 5 years for digital health specifically. And so I think as the FDA and the FTC sort of grapple with health IT and software, and they're taking a lot more notice of some of these companies, that's going to be one of the questions. Is sort of does are your claims based in science? And I think that matters.
Well, I guess I was a little surprised with the FTC instead of the FDA.
Yeah. Well, so, and this is a huge frustration for those that work in health IT, is that the FDA itself has been kind of vague on what they consider a medical device and what they don't. They've been really wishy-washy on the whole topic. And so, they don't consider, a piece of software a device necessarily, or a drug. And so the reason for that is that, most of them aren't designed to, treat or cure disease. So the FDA is still kind of grappling with it. And that's been very frustrating for those who are developing technologies in the space because they don't know, if they have to go and get, FDA approval, either Series 2 or 3, for what they're building. So that horizon is kind of a little bit murky. But I think where the FTC kind of came in is just kind of like public claims. They were saying they were marketing this and saying, my app does this, and it'll actually prevent this. And it can treat your vision and prevent you from losing more vision. And the FTC said, well, hold on. If you're making a claim, like that, then, can you prove it? So they're being held, at the same standard to, a drug that's being marketed to treat diabetes or, a device that can treat, aortic stenosis. So I think that's something that we're going to see more and more of.
How is it, the FDA or the FTC that came down on the tree?
I think that was FDA.
So two people should.
Yeah.
And that's because we need to solve claims.
Yeah, I think people are just taking notice is the key point, and the question that's coming up is the science behind it, the validation. Prove to me that this works before you go out and claim it. So, and this by no means, this is not saying that they're right, but they're at least taking notice is the point. Sure, and this is something that we're kind of working through. It's not easy. A clinical pilot requires that you be able to get a member of the faculty to kind of champion your idea and to sort of sponsor it through the IRB and at the VA, the R&D committee as a regular clinical trial. So what we're doing, on our side is really trying to build up a good list of faculty that have an interest in working with companies like this, and then sort of shepherding them through that process. So it's no different than launching any other kind of clinical trial that you would do in a medical center that has an IRB, and that's the process that we're going to take. It's a little bit different than sort of like those back office pilots that we're talking about, ones that are focused more towards that less directly touch patients. Where the IRB kind of comes into play is when you're actually doing a pilot that directly touches a patient. So if there's anything sort of above that, we're working with. We have some other courses that we're taking at a higher level through Emory Healthcare and the enterprise level of care. So it'll vary sort of on a case-by-case basis, but it's a really hands-on process. And this is not, from us, this is not a very sort of passive agreement that we've put into place. We're actually, doing surveys within Emory Healthcare, within the VA to find out who's interested, and then really, building a very clear pathway for some of these companies. Working with the IRB, trying to streamline these applications. I think there's a lot of skepticism from the IRB when it comes to some of these new technologies that are digital and they can't physically see and touch, and it's kind of beyond the scope of the typical things they see in clinical trials like drugs or devices. So it's a lot of sort of education. It's hard to kind of go into specifics without talking about a very specific company, but it really involves a lot of like, hands-on sort of, guiding and sort of playing matchmaker in a lot of ways.
Is there a model for you Stanford or
It's funny you mentioned, so Stanford and GE Ventures just launched a company called Emanation Health. It's a company that's actually dedicated to doing this exact same thing. They sort of sell it as a service, and I don't know what their model looks like, but they also take the same approach, which is, they help digital health startups sort of launch these sort of in-house pilots to be able to, sort of validate their technologies. And I'm guessing evidation comes from a combination of evidence and validation, which is kind of what they're looking for. So we're seeing a lot more interest here. It's called Emanation Health. Evidation. DATION, yeah. So, and that was a joint venture launched by GE Ventures and Stanford Healthcare. And it's a standalone company that's raising money and doing this sort of as a service. So we're not that greedy, we're doing it as a nonprofit. Rock Health was an investor, I think AMV was an investor. So they're still very early stage. And I'm guessing GE Ventures was an investor as well. Question?
In this era of EHRs and new business requirements,
Yeah.
the founders form interested in physician first companies
What do you mean physician first?
that kind of address overload the doctor's position of these EHRs or needs that ever came to.
Absolutely. And as a physician, I'm all on board. But yeah, I think, the EMR space is becoming very sort of consolidated, especially at the large enterprise level. I mean, if you're at Emory Healthcare or a Grady, or even a Wellstar or Piedmont, there's 2 companies that you can buy from. Or Cerner, right? I mean, Athena Health is trying to make some inroads there, but and so those are only 2 options. So one, I think the issue was a lack of competition, but it's expensive, and I think they have a certain amount of traction that makes it hard for new sort of entrants into the market to sort of beat. I don't think Athena Health's strategy is to try and build their own standalone EMR for enterprise healthcare system. I think they have this whole, John Bush talks about this whole Internet of Healthcare sort of model where they want to be able to sort of provide a backbone and then people kind of buy plugins to sort of meet their needs, and one of that includes I think larger hospitals. But absolutely, I think I can tell you firsthand that there is tons of innovation that can take place when it comes to EMR, EMRs have become great data sinks, right? I mean, if you log in, they've done a good job from the provider side of things of amassing tons of data, right? So I can log in, and if I know where to look, the data's there, right? If I wanted to look, if I want to see vital signs, if I want to see what their labs were, the notes are abysmal, and I think that's one of the myths of EMR was, that was sold to physicians was that this is going to be a great way for you to document. You can read other people's notes, handwriting isn't an issue, the same thing when it comes to ordering. We were promised that, we'll have, more accurate orders, there'll be less mistakes, less errors, and none of that's actually happened, right? Medical errors are on the rise. When it comes to notes, I mean, and this is sort of where that dichotomy between payer and user kind of comes into play, because, and the notes are a great example, the progress notes, because from a payer perspective, they look at the progress note as a document that leads to higher billing, right? As a physician, for me, the progress note is communication information. And so now you see them bloated with all this information that's required for a higher level of billing that for me is useless. But there's a dichotomy there, and there's a give and take there, and so I think there's a lot of room for innovation there. For me, one of the big things I'm looking for is sort of more like intelligent systems. Why do I have to dig around to find information, and why can't the system tell me what to look at? Right? Why can't it tell me, this patient, based upon all these data points that we have in real time, this patient is at risk for being readmitted in 30 days if you send them home based upon, these parameters that we know already exist. And that data is there. I mean, there's a lot of data on this publicly, except no one's kind of, taken that next step. So is there room for improvement? Absolutely. Are we interested? Absolutely. And we'd love to work with a company that's working in that specific area with a very good plan. So.
You say that med errors are on the rise and attributable weight to EHRs?
I mean, I don't think there's like a direct link there. But if you look at the number of medication errors, and you look at the point where EMRs became widely adopted, this sort of like fall off that we were looking for hasn't happened. Medical errors are still, I think, the 8th leading cause of death in the country. And that's a big deal. And what we've realized is that the technology was a small part of that, right? The human component is still there, right? No matter what I put in the chart, right, it still takes a person to physically push the medication, for example. So, and I think that's a place where you see a lot of mistakes still happening in the hospital. So they're doing things with like barcodes and BICMAs, but it's still an issue. I mean, we haven't seen the point is we haven't seen medical errors kind of like drop off completely. And I think that's a role that EMRs can really play and make a big difference. Yeah, partially. I think that plays into it too. Is, I mean, if you've been inside of an ICU in the past, ever, I mean, literally there's alarms going off every 5 seconds. So they keep getting louder and louder. Any new device that comes out makes their alarm sound a little bit more different. And so, yeah, I mean, I think that's part of it. And I think it's, healthcare is becoming a really sort of, complex and, busy environment. So, how do you identify the signal not the noise. And so, all right, guys, thanks very much. Am I good on time?
I do actually have a question for you if you don't mind to stay up.
Yeah. I have to stand here and answer it?
You don't have to stand
Do I
there.
have to use the mic?
I guess I have two questions for you. One, in terms of, you mentioned the mind health, you talked about fit. A lot of the focus is on self-report.
Yeah.
How would something like the Founders Forum really help, startups work on that piece? That's a large part. You really want patients to be part of whatever tech they're using. What are some things that are working?
So one thing that Emanation Health does is at least they've sort of made it kind of, for lack of a better phrase, idiot-proof. So when they give you a scale, it's actually tied to your account, and so all you do is turn it on and step on, right? So we're not saying that we're going to help every company solve every problem. This is a first step, and so we're going to really help people sort of take what they already have, and so where you start is kind of a big thing for us. What you're coming to the table with is very important for us. And to get that into a setting where you can actually validate it in some way, shape, or form. Can we sort of are we going to fix that problem? I don't think so, but I think what a lot of companies doing are kind of what I just said, is that they're using sensors in a good way. They're doing them in a way that doesn't require the patient to type in the data themselves automatically. It transmits directly into the system. That's kind of what you need for a lot of patients, because a lot of Emanation Health works in an area where I think patients are probably a little bit younger. But cardiac rehab, for example, is a patient a little bit older. So if you give them a scale and a blood pressure cuff, I think that's going to be kind of challenging for a lot of people to use. So is there sort of a need to really make it as simple as possible? Yes. Can we do that as a service? I can't make that claim. But if it's at the point where it could really benefit from doing a pilot at one of our partners, then we're there to help. That's a very vague answer, I know, but yeah.
Are you thinking about other partners besides the one thing you did so big? Have you thought about just like smaller hospitals? And if you look at smaller hospitals, they can figure out this probably faster, they easily want to scale.
Yeah, and so this is a starting point for us. These are entities that we have relationships with in place. Are we opposed to working with other hospitals? Absolutely not. Gwinnett Medical Center was one of our sponsors for the hackathon. They've expressed interest. I think they're being bought out by Northside. Someone let's check me on that. Even in that sort of, even the smaller hospitals themselves are kind of being gobbled up by the bigger players. So pretty soon, I think, especially in a large metro area, small mom and pop hospitals, are going to soon be part of these bigger healthcare systems. So, are we opposed to it? No. It's just for us. This is our starting point. All right. Thanks very much.